Hello. I'm hoping that everyone can hear me. My name is Dr. Christine Stamatos. I'm a nurse practitioner from Northwell Health, and I'm here to talk about fatigue. Why can I talk to you about that? My background is I actually run a fibromyalgia long COVID clinic. And I work in the field of rheumatology and deal with patients that have rheumatic diseases on a daily basis of all kinds. And fatigue is, as you all know, one of the most important topics that we have out there. I would say, 90% of my patients have a complaint of fatigue. And we're going to talk today in the next 20 minutes about how to start to address that issue. What I hope to be able to achieve today is to help you understand sort of what are the mechanisms of fatigue and what goes into it. And hopefully you'll walk away going, oh, wow, I didn't know it was that complicated. But that might help to explain to you why you feel like you live with fatigue on such a regular basis and why it takes so many different things to get that fatigue under control. I also want to make sure that you walk away today knowing what is the first step to attacking this fatigue, and then what are some of the subsequent steps. And hopefully I will help leave you with some reliable tools that you can use to assist in getting better sleep and feeling less fatigued. So when I said that it's complicated, it truly is complicated, right? So when I was asked to do this talk, and I thank the organizers for asking me to do this, I thought, I can do that talk in my sleep. So then I started putting the talk together. And when we're talking about autoimmune disease, rheumatic diseases, when you have activated the immune system, it causes any number of cascading and interacting effects. And I don't expect for you to look at this slide and go, oh, okay, I know exactly what that means. And I'm not going to actually explain every step of that. But what I want you to see in this slide is that there are so many factors. So there's inflammation that's happening in the brain, in the body, and that inflammation changes the central nervous system. It changes the neuroendocrine system, which is your hormones. It changes the axis that controls your energy, which is your cortisol axis. It changes the autonomic nervous system. It changes your sleep patterns and your ability to get into a deep restorative sleep. It changes it causes metabolic changes. Those are all physiologic things that are going on. While at the same time, you can't discount the fact that there's a lot of psychosocial things going on. There's anxiety, there's illness perception, and how we're examining what we're going through. There's depression, there's physical activity, there's the food that you're putting into your body. All of these things are going to influence your energy level. So let's talk a little bit more about what's actually happening. So the first step, and that's why really I say the very first thing you always have to do is to make sure that the inflammation is under control as best as possible, because all of this is triggered initially by some inciting event, whether it's an infection, whether it's an acute illness, whether it's a surgery. Something turns on inflammation in the body, and that inflammation releases a number of chemicals. Specifically, when we think about them, we use the word cytokines, and cytokines are chemical structures in the body that are part of what activate the inflammatory response. And when someone is sick, the body goes into, they actually call it a sick mode, and it releases IL-interleukin 6, tumor necrosis factor, interferon, and all of those, what we call cytokines, cause you to feel fatigued. And that's a protective event. It's actually designed to make you stop what you're doing so your body can heal and get better. But when you have a chronic disease, that becomes another problem. And sometimes that inflammation persists. And so you have these chemicals that are out there in really high volumes. Those chemicals then get into the brain and they change perfusion in the brain, and they cause inflammation in the brain. And that causes changes to the nerves and the mechanisms with how the brain works. So once I get rid of the inflammation, I might still have inflammation in the brain itself. So that's also contributing to fatigue. These cytokines also trigger the sympathetic nervous system. I think you've probably all heard of the fight or flight response. So that then also contributes to a high energy level. It uses up muscle mass. You actually have loss of muscle mass because the body calls upon muscle that's there to give it the energy it needs. So that further feeds into fatigue, and it further disrupts your sleep. You can imagine if you're in this fight or flight response, it's very hard to go to sleep because your body's like, whoa, I got to respond to something. And so it doesn't go to sleep, and that's very disruptive, and that leads to fatigue. Additionally, we talked about the HPA axis, which is the cortisol. You've all heard of the adrenal system. So when the body gets stressed, the adrenal system is activated. Part of the sympathetic nervous system is to trigger the release of cortisol. Cortisol, again, is something that makes you feel alert and awake. So when you try to go to sleep, you can't go to sleep. So that further leads to fatigue. And when that becomes a chronic issue, it leads to actually cortisol insufficiency or hypoadrenalism. And that actually causes, again, more fatigue once all of the inflammation. So let's say the inflammation in the brain was gone, all those cytokines are gone, but now your adrenal system's burned out, so you have fatigue from that perspective. So this is just one slide in a 15-minute talk to explain to you the number of different factors that are going on that lead to fatigue. I'm going to go into a little bit more of it here just to show you, because I found this very impressive, the difference between the brain that is not inflamed and the brain that is. So if you look at that first little amoeba-looking thing, that's a brain cell without inflammation. And then if you look at the second image, you can clearly, anybody can see that that cell is absolutely not going to function the same. That's the microglial inflammation. We're actually now understanding that may be part of chronic pain syndromes that follow some of our autoimmune diseases. But again, some of the very specific things that happen when this occurs is this inflammation then inhibits the production and utilization of norepinephrine, which gives us energy. It also breaks down and makes less available for us serotonin and dopamine as well. And when you don't have enough of those, if you don't have enough serotonin, if I could see you all right now, I would ask you, what is that going to do to you? Well, that's going to cause you to become more depressed, not feel well, feel sort of hopeless. And when you don't have enough dopamine, you have trouble focusing. That's where that brain fog comes on. So you can see there's lots of different factors that are going on here. These mechanisms, when they're disrupted, only lead to more inflammation. And there's been documented evidence on functional MRIs that prove some of these changes. So let's again, just because this is probably what it all goes down to, the fight or flight response. An exaggerated fight or flight response sets up an inflammatory state. Again, those cytokines I talked about before trigger the autonomic nervous system that simulates that fight, and it inhibits the parasympathetic nervous system. And the parasympathetic nervous system, so if the sympathetic nervous system is fight or flight, the parasympathetic is rest and sleep. So if I inhibit that, again, I have a reason for inhibiting my ability to get good sleep, which then again leads to fatigue. There's also an imbalance of melatonin and cortisol. So when you have high levels of cortisol, the body is making less melatonin, also contributing to a difficulty to be even able to fall asleep. So you can again see all these competing forces that are happening at the same time. Even again, once you reduce the inflammation, those other abnormalities still exist in the body, and that's why fatigue persists as long as it does. So again, I want you to just think of chronic stress and what it does to us. This is a picture of me when I was working in the hospital. So I was actually seeing patients in the office and helping patients in the hospital because we were overwhelmed. Imagine what stress was going on for me, just like all of you living with an autoimmune disease in the middle of a pandemic. That set up a chronic stress response. And we know that chronic stress response leads to ultimately adrenal insufficiency, which ultimately leads to fatigue in and of itself. But there are some common predictors of fatigue in chronic disease. So one of them is pain. So the more, and you just had a pain talk from one of my favorite people on the planet, Dr. Afton Hassett. And I know she talked to you about pain and things that you can do about pain, but leaving pain treated certainly leads to disruption in sleep and then therefore leads to fatigue. Depression also markedly leads to more in fatigue. Sleep disturbance, and we'll talk a little bit more about that. And then the more you feel pain, the more depressed you are, the less you actually do. That actually leads to reduced physical activity. Reduced physical activity leads to less muscle development, actually loss of muscle development. And really, muscle is where we get our energy from. That's where your active metabolic tissues are. So when you have muscle mass loss, that leads to fatigue as well. And then lastly, chronic stress. So these are the predictors that tell someone, so if there's pain present, depression present, sleep disruption present, and ongoing stress, that person is at super crazy high risk for fatigue. And if I could see you all, I would see that you're all probably shaking your heads because you all probably have these symptoms and issues that you're dealing with on a regular basis. So again, the autonomic nervous system, I have this slide here because there is some exciting new development. And so with the autonomic nervous system on basically overdrive, the parasympathetic nervous system is not active. And we know that if we can activate the parasympathetic nervous system, we can reduce the formation of those cytokines. We can reduce the cortisol formation, which is going to reduce that stress response, and the body goes into a relaxed state. Well, one of the main parts of the parasympathetic nervous system is actually the vagus nerve. And this is crazy exciting because there's more and more evidence in lots of different disease states that stimulating the vagus nerve, and even doing that non-invasively. So you can stimulate the vagus nerve with an outside machine on the side of your neck. That stimulates the parasympathetic nervous system. It reduces inflammatory cytokines and it induces a calm sense and relaxes the body. So there's some evidence, lots of mounting evidence, that stimulation of the vagus nerve actually improves fatigue, improves pain, it reduces inflammation. There's research out there looking at it in lupus, in Sjogren's, in rheumatoid arthritis, having a really significantly positive effect. Again, a non-drug stress reducing strategy that's out there that's showing a lot of really good promise. So I encourage you all to look at the field related to vagus nerve stimulation. So sleep disruption itself leads to more sleep disruption, right? So poor sleep leads to fatigue. Fatigue leads to poor sleep. That becomes a vicious cycle back and forth. The less that you do, the less that you sleep at night, the more likely you're going to take naps during the day. Those naps during the day interfere with your ability to sleep then again at night. It also leads to a decreased cardiovascular fitness and activity tolerance, which only further worsens your sleep. Then you also have issues that you can't tolerate being with other people, doing activities, going to those family events or friends events. And so you start withdrawing from social activities. That leads to depression, which we already talked about, leads to more fatigue. And I love this slide. This is actually my 99-year-old father-in-law. And what happens with sleep disruptions is it causes you to be asleep when you should be awake and awake when you should be asleep. And I'm sure everyone in this listening has been a victim to that problem at times. Metabolically, again, we talked about the fact that fitness and activity promote more energy. You have to have muscle mass to have energy, and decreased activity leads to what we call sarcopenia, which is loss of muscle mass. And that loss of muscle mass leads to reduced strength and decreased endurance. These are actually patients of mine that with exerted effort were able to improve their weight, manage their weight better, and actually went and did this mud run, which I think was so impressive. And by taking care of these issues, you can reduce fatigue in a pretty significant way. Again, I'm sort of touching on all the different things that we talked about that predict fatigue. So psychosocial issues, mood, we talked about pain. This is an example of one of my patients. I ask them always to tell me where their pain is. This is someone whose pain is not under control, as you can see. Also, the way that we think and feel and interpret the world affects pain and mood. And this is a picture that lady always just reminds me of a term called catastrophizing. And catastrophizing absolutely causes mood to be worse and contributes to fatigue. And so you need to recognize if you're someone who does that. We have 5 minutes to go, and I just want to leave with a couple of tools to help you and to think about. And what can you do about these problems? As we said, they're pretty widespread and there's lots of competing forces. Just remember that there is not one treatment. It really takes a whole bunch of different things. And I always like to talk about the car with the 4 tires. So when we want to get better, when we want to deal with chronic fatigue, when we want to help with chronic pain, you have to address all 4 tires that you have going on in your life. One tire is using medications, procedures, injections, but the other tire is physical strength and endurance. You can't stop moving. We know that that makes pain and fatigue worse. You also have to maintain your social connections, and you have to make sure that you have your own personal coping strategies. That's what that don't panic is about. So how do we fix this? Well, you have to control the underlying pain. You have to control the underlying inflammation. Again, that's the first thing that has to happen. You have to treat, if depression is there, you have to treat that depression, whatever it's going to take. Remember, your neuroendocrine hormones are off balance. So we sometimes have to use a medication to fix that balance. Sleep disturbance, you have to address. Reduced physical activity. There's a wonderful study. There's lots of good studies that show that exercise helps people feel better. But there was a wonderful study done a few years ago, I think in Norway, by the group Svies. And they looked at people with ankylosing spondylitis or spondyloarthritis. And they found that an aggressive exercise program of 30 to 45 minutes a day absolutely reduced fatigue. So I can't stress that enough. And managing your stress 100% helps to manage your fatigue. I'm not going to go into this because I would imagine this group is very familiar with it. But when we think about Christine Massarodino's spoon theory, that's all about exercise and activity, balance, energy conservation. And that's what you all have to think about. These are some amazing, awesome books that I just really love. Why We Sleep and Sleep to Heal are fairly new. They just came out this year, and I really like them as a resource to give you some guidance. And I've been a huge fan of the apps. So I really encourage my patients, if you have trouble falling asleep or you wake up in the middle of the night, I want you to look at these different apps. They have literally thousands of stories, bedtime stories, music soundscapes that will help you to fall back to sleep. And I want you to consider using them. And I want you to think about your bed as a charging station, right? We put our phones down to charge. You need to put your body down. Sleep is not an option. It's absolutely something that is essential. And we typically need between 6 to 8 hours of sleep. You need a minimum of 4 just for muscles to relax. So if you're not getting 4 hours of uninterrupted sleep, your muscles aren't going to relax. That's going to lead to more pain. Ultimately, you need to get 8 hours of sleep. And this book that I told you about, the Sleep to Heal, talks about thinking of sleep as an elevator. And you have to get to those top floors because it's at that top level at floors 6, 7, and 8 that you record and organize your thoughts and your memories, and creativity comes from. So you really have to get to all 8 hours of sleep in a perfect world. We don't live there. You want to make sure that you start your day out with the right strategies to help promote sleep at night. So you want to spend time outdoors. These are pictures I've taken in my life. You want to make sure that when you're outside at least a half an hour every day, you have your sunglasses off. You want that to trigger the cortisol release. Ideally, your outdoor time is better when taken in the morning, but any time of day is okay. If you're on the computer, you want to move a lot. You don't want to sit there all day. You want to be careful with naps. You want to make sure your diet is healthy, and you want to minimize use of your bed except for at night and for sex. And then at night, you need to make sure that you prepare for bed properly, that you have rituals, that you go to bed and wake up at the same time every day. You minimize your screen time before bed. I think most people know that, but most people don't do that. There's efforts to say that you should shower. It cools the body down and gets you ready for sleep. You definitely sleep better in a cool, dark, and quiet environment. There are all kinds of guidelines for how to stop the brain from going crazy when it can't stop and shut itself down. You want to learn how to do some deep breathing. I have on here, don't look at the clock. So if you start staring at the clock, you can imagine that's only going to increase your anxiety. And that's it. I made it through my talk in 15 minutes. I would love to be able to answer questions, but I don't know that that's what's happening at this point. So if the organizers could tell us what the next steps are, I would be greatly appreciated. Thank you.